We weren't able to get to our regular feature from our friends over at the Guam Regional Medical City, your healthcare partner, because we actually had a typhoon that was going on the day that you normally would come in. So let's introduce to you our subject matter. Dr. Felix Cabrera, good hometown boy, running the show at GRMC. Good morning, sir.
Good morning, Patty. Thanks for having us on.
It's my pleasure. And Dr. Zachary Pruhs is here with us as well, a rheumatologist.
That's correct.
Wow, how are you?
I'm doing just fine. Thank you for having me.
Yeah, absolutely. You look corn-fed.
I am.
Are you?
I am not from Iowa, but right next door in Wisconsin.
Okay, well, he's from Wisconsin. Put your headphones on there, Bob. Can you hear him? Meet Bob Gaith.
I'm from Milwaukee. So,
fantastic. Yeah. I'm 68th in Wisconsin.
I was over on Vollmer Avenue, right near St. Francis.
Oh, fantastic, fantastic.
My house is past the first bus stop after the coconut tree in Tamunik. And you?
Yeah, just if you've gone past that, then you're too far. Yeah.
Well, I tell you, we just call them like we see them. I didn't mean to judge a book by its cover, but you certainly look like the likings of Bob Gaith. I can spot him, these Wisconsin boys. Well, it's nice to have you here. What brings you all the way to Guam? Well, rheumatology, clearly.
That's right.
Yeah.
That's right. Well, I was looking to do some international work over time, and my kids are actually the perfect age for it right now. They're 10
awesome.
and 7.
Nice.
And then this opportunity came up with GRMC, and Dr. Cabrera actually informed me that I would be the first rheumatologist to set up practice on the island, which I'm very excited to be. I'm very proud to be as well.
Wow, you know what? And what a great selling point that is. I had a colleague of mine who worked here, and we were traveling in Italy, and she was complaining about joints and swelling, and she just couldn't put her finger on it.
Sure.
She couldn't put her finger on anything. She was in so much pain. It was really horrible. And she came here, and then she's like, there is no rheumatologists here. And she had done a bunch of testing, and she had been diagnosed with arthritis. And she now lives in Honolulu. She's a journalist, and she's having a baby. So life is grand. She's getting some great care. But at the time, it was so frustrating because she just to watch her in pain and having really no recourse than to travel away was I don't know if you've ever lived in an area where that kind of specialized care is not available.
Specialized care, well, yeah, I mean, rheumatologists, we're not the most common practitioners out there, I guess. So, yeah, I've never been in an area where I was the first, but it's a great opportunity to be able to bring this.
Are you opening up some doors for people here? Have you already? Because I just got a note from somebody who says, I have RA. How can I see a rheumatologist?
Right.
How can they see you?
Right. So, I have set up clinic, and we're in the process of kind of onboarding and getting everything up and running. And we're seeing patients. I think I've seen 3 inpatients and maybe 5 outpatients so far. And rheumatoid arthritis RA is my bread and butter. I see an awful lot of RA. So.
What is it? There are some of the same symptoms that you would find with RA and something like gout. We have a big gout community here.
Right. Yeah. So both of them have an awful lot of joint pain that goes with them, and they both can have flares too. It's kind of a different source of the inflammation. With rheumatoid arthritis, it's a problem where your own immune system, or your own body's defenses, your white blood cells, they kind of lose the ability to recognize your body as something that's not supposed to be attacked, and then you get inflammation from that. So autoimmune disease, as opposed to gout, which is a buildup of too much uric acid in your body, which is basically like a waste product, okay? And then that waste product, that uric acid, can settle into the joints, and when it settles into those joints, it irritates the joint itself, and it causes all this awful inflammation from that. So they both cause a lot of joint pain, a lot of inflammation, but it's kind of different. You would call it like a mechanism of action, I guess.
Are you finding that Guam has a larger population of RA? Are you finding, well, you've already been introduced to several patients, so they're seeking you out.
Right. So I think that rheumatoid arthritis and gout strike across across the spectrum of populations. We see it pretty much everywhere in the world. And actually, Dr. Cabrera, and I don't have the numbers to reference right in front of me, but he put together projections based upon the population of Guam, and there is an awful lot of disease.
You did some research.
Yeah, so it looks like about, potentially there's over 9,000 patients on Guam right now that suffer from gout alone. And so, but then you add in rheumatoid arthritis.
Is that what they call the nickname is the rich man's disease? Is that what somebody told me one time? Is it because it like seafood or
well, back in the day,
food?
what it used to be a disease of overindulgence as well. So, so it was the disease of kings, and and for obviously those who could afford to overindulge.
Yeah.
And so.
So I'm curious when you find these specialized care and respond to it, Dr. Cabrera, do you do some research, or do you find that people come to you and they're like, I need this, and then you sort of go out on a search?
It's definitely a mix. It's so it's from my own struggles as a internal medicine physician trying to manage these patients, particular who really need the specialized care and need specialized guidance. Myself as a primary care doctor, there was only so much I could do, and it really took another level in order to ensure that they had a proper care plan in place, and so a lot of times it would mean them having to go off island.
So it's as simple as that? I mean, it's as simple as supply and demand.
It really is, and so I've listened to my patients, I've listened to other providers on the island, and really when it came down to what was going to be the next service that GRMC was going to offer, rheumatology was very clear, was a very, very clear need, and it's something that really complements everything else we do already. And so what's funny is that we almost by accident created our own bone and joint center clinic with when you think about having a rheumatologist who part of what they do is mainly arthritis in the joints, but then with Dr. Galang from our orthopedic surgeon, and then Dr. Tottenauer, our podiatrist, together they make a great team, and so
now you have a joint and bone center.
Yeah,
sounds like a great place to get wings served with special sauce. That's pretty cool. Well, that's pretty cool. So it's sort of like a one-stop center.
Absolutely.
And so all of this is actually within your working space.
Yeah.
That's right. That's right. They're Dr. Tottenauer and Dr. Galang. I mean, we walk past each other in the hallway multiple times a day, so we see each other all the time.
It's really interesting how you're able to do that at GRMC, is compartmentalize these services where you're within walking distance of every kind of clinic that you need.
Yes, absolutely.
It sounds like that's a great plan to do, but you can run out of space, can't you?
Yeah, space has been a challenge.
Yeah,
as big as the hospital is, for our outpatient services in particular, we've had to be creative in how we stack schedules together and put providers together. But in the end, the clear thing is that we want a cohesive environment where they can work very closely together and really bounce things off each other. And it may not necessarily mean that a patient has to make multiple visits with 3 different providers. It may be with one, and then they get the opinion of 3, which I think is great.
Is rheumatoid arthritis, is that something that's handed down? Is it hereditary? You get it from your family? Yeah.
So there are, the way that we look at autoimmune diseases is that we all have genetic predispositions towards different things. Some people it's high blood pressure, some people it's, diabetes, things of that nature. And there is a genetic component to rheumatoid arthritis. And our best understanding at this point is that we have this kind of genetic predisposition towards autoimmunity, and then we come across something in the environment. Sometimes it's like a viral infection. We know that cigarette smoking is a trigger. So we come across something in the environment, and it flips this switch from having the potential to have autoimmunity to have the disease manifestations of autoimmunity. So, and in terms of passing it down through families, we have found a number of genes that are strongly linked to rheumatoid arthritis, but it's not a 100% thing where we can point to one gene or another and say, aha, here's our rheumatoid arthritis gene for certain in this person. And it's not something where we can run a panel of tests and say, aha, unfortunately, you are guaranteed to develop rheumatoid arthritis. It's not at this point.
It's not as simple simple as that. Do autoimmune diseases also encompass like skin diseases as well? Can you find like psoriasis and
Yes, very much so, very much so. In fact, there is a strong predilection towards arthritis in our psoriasis patients. For example, if you have psoriasis, there's anywhere from a 5 to 30% chance that you will develop arthritis at some point. And unfortunately, there are some predictors out there too. People who have particularly bad nail disease with their psoriasis are more predisposed to developing joint disease as well. So there is, yes, very much so. And then there's a spectrum of skin diseases that go along with many of our other illnesses, lupus and even some of our vasculitis or inflammation of the blood vessel diseases. You can see a whole spectrum of rashes.
when you say environmental, if you are not predisposed to it, and if you move to another climate, for example, can you stop this from developing?
Right. Oh, I wish it were that easy. We'd all be living in the desert in the Southwest.
Exactly.
Right? Easy on the joints. Actually, they have done a little bit of research over time. People with rheumatoid arthritis, for example, who've moved to warmer, drier climates, and it looks like it helps for a couple of months, and then after that, they kind of revert back to their baseline. Unfortunately.
So the best course of action is still medication. Or is there anything else that can be done sort of organically that could reverse some of the symptoms?
Oh, I mean, lifestyle and physical activity and all the things that you will hear from every physician that you talk to over time are so important. There are, unfortunately, there are people who have really severe disease that are going to require some sort of medication, oftentimes lifelong. But yes, in terms of diet and exercise and smoke avoid or tobacco avoidance, I should say, those are very important. And many of those things, that we all try to do as best as we can on a daily basis will make a big difference in especially function over time.
I'm wondering, was there any data or any research that showed that things might be different in certain cultures, in certain climes?
Yeah, well, gout, for example, it's actually well known, and we learned this from early parts of medical school, even that gout very much has a high prevalence among Pacific Islanders, including Filipinos, in that category. And so when we're stateside, they're more likely to be the ones that suffer from gout. So they're singled out in a sense more. So here, that's obviously it's even more common because everybody has that potential.
The lifestyle.
Yeah, the lifestyle and that potential that with their genetic background. And so that's so gout is the one that stands out the most. But then otherwise, I think it's fairly well represented incidents here on Guam when it comes to the other diseases, in particular like lupus, for example, and lupus being one of the more challenging of the autoimmune diseases. And so in fact, there's the lupus awareness group of Guam who were very active.
And that has just really cropped up relatively late.
Yeah, and in fact, there was just by chance they had their 2K, 5K benefit on just this past Sunday.
Okay.
And Dr. Pruhs and I actually joined in, and we ran in the rain, and we supported them.
And that's great because for so many years, I know that there were people who had lupus that didn't talk to anybody. It was such a private conversation. They didn't know who had it. But once the associate, if I'm not mistaken, it was Marie Calvamonge that was one of the earlier people to bring awareness.
Yeah, what's really great about what they do is that they really offer support for each other first and foremost, and then they share resources. They do different things in terms of helping guide not just the patients but their family members as well. And then now they've actually been the voice for all autoimmune disorders in Guam, and they really have been spearheading that. And so they're a really amazing group of people who really took ownership of their own diseases and their families' struggles with it. So we're very happy to be part of helping them with their challenges. Is
rheumatoid arthritis, RA, is it detected at a certain age? Can you get it? Can you know a child has it? Is there such a thing as youth RA? Or?
Oh, there is. There's juvenile onset arthritis, certainly. Rheumatoid arthritis can affect people at any age. It tends to be, early middle age, oftentimes, and younger. There are some really good blood tests out there that we can send that suggest that somebody has rheumatoid arthritis. It's really a clinical diagnosis, though, which is one of the reasons that it can be so tricky, because the blood tests are not 100%, and there's physical exam and there's history, the duration of symptoms and the timing of symptoms. For example, most people with rheumatoid arthritis, early in the morning, they'll have their worst symptoms, stiffness and swelling and what have you. So it's a clinical diagnosis that, we do a bit of detective work, and we try to put it all together and then, make the diagnosis if it's appropriate at that point.
People who have had RA, is it become debilitating as they get older?
Oh, it can really be.
What's that on the end of that spectrum?
Yeah, it can really be terribly debilitating. Oftentimes, when you start out with rheumatoid arthritis, it'll be fairly mild symptoms. It can come on like a thunderclap, where it's just absolutely debilitating right out of the gate. But oftentimes it can be more of an insidious onset where you develop a little bit of morning stiffness and a little bit of swelling, and then gradually over time it gets worse and worse.
Is it mostly in the joints, like fingers and toes and that sort of elbows and knees?
Yeah, I mean, it can have other disease manifestations. In severe disease, it can affect the lungs and all this other stuff. But most of the time, it tends to be the small joints. It tends to be the hands and the wrists, and sometimes the feet and the ankles and that sort of thing. And oftentimes, that's where we'll see our most pronounced swelling as well. So, yeah, and then treating it early. In the old days, in the old days weren't that long ago. I'm talking like 10 years ago.
Yeah.
We used to gradually introduce medications and just kind of try to slowly tune things up. Now, early aggressive therapy has been shown to be the most important predictor of how well people do long term. Because if you prevent the damage from occurring early on, then you can keep people at a high level of function and make sure that they're able to do the things in life that make life worth living.
Does the research and the technology, is it forward? Is it progressing at a rate to answer some of the questions that are still out there unanswered?
Oh yeah, very much so, particularly on the medication side of things, because there is just a whole slew of medications available now that 10 years ago, 15 years ago, they just weren't there. They hadn't been invented. So the biologics in particular have really, when you look at the kind of the history of rheumatoid arthritis treatment, one of my mentors back in Nebraska, speaking of corn, was when he was in fellowship, training for rheumatology, the big news on the market was naproxen, which is Aleve. Okay?
Right.
And now, I mean, we are light years ahead of that.
Really?
Oh yeah.
But that's not nothing over the counter. That's all controlled prescription.
Well, at the vast majority of rheumatoid arthritis medications are prescription medications. Yes.
All right. Tony's got a question for, if you don't mind. He's on the phone right now. Morning there, Tony. Say hello.
Hey, good morning.
Good morning.
Ladies and gentlemen, good morning to you. First of all, can I say, Dankuluna Sidzus Masi, thank you very much for those gracious doctors that are there in your station this morning. My wife and my daughter are jumping for joy because, they are frequent flyers to the Philippines for their treatment of their rheumatoid arthritis sickness. And when they heard that you guys were coming out to Guam to establish yourself at GRMC, it's such a joy because, one of the kind of hardships there is that you are right that it's a very difficult sickness to handle, especially like you said, you have to change your of eating and so forth and all that, but. Even with that, it kind of becomes really hard for them to, get over their sickness because sometimes the medication works, sometimes it doesn't. And also a recent issue with my daughter is that it kind of took the insurance companies here on Guam to okay her medication for her for arthritis because Jesus, I've seen the sickness the way it goes with my child, and just approving the medication for that sickness, it takes an arm and a leg and a lot of handling of please approve it, please approve it. But they finally approved it, and thank God, my daughter is doing a lot better than she was several years ago or several months ago.
Good to know, Tony.
So I thank you guys for coming out to Guam and finally establishing themselves. I know that, seriously, I'm here at GRMC. I'm going to drop off the referral paper for my wife.
All right.
So that we can schedule, for her to go in and see one of those gracious doctors that are there. Again, we welcome you to Guam. And please continue to help the people of Guam and everywhere in the world. Thank you very much.
His name is Dr. Zachary Pruhs, okay?
All right, doctor.
It rhymes
we'll
with
be seeing you then.
Thank you.
It rhymes with cruise, but it's Pruhs, okay?
That's
All right.
again.
Thank you so much, Tony.
Salamat po, I guess, if you're Filipino.
In all languages, Tony. Thank you very much. I appreciate it. That's a point. Not everybody may have the ability to go. Is a referral what is necessary here in order to see?
Well, it is for primarily because what we want is important is the partnership with a primary care provider as well, and that for example, Dr. Pruhs is going to take on ownership of the main care plan in that case. But by having a referral, it allows that communication between him and the primary care provider. But if there is no primary care provider, we'll figure it out. We'll figure out a way to be
Well,
seen.
that right there is what separates you from the rest, because there are a lot of people who feel like Tony does. You have to fly off island because you feel like there's absolutely, no human sort of contact that will allow for some of these extenuating circumstances, which extenuating circumstances have turned out to be quite common,
Yes,
unfortunately.
yeah, exactly. And so, if somebody has an insurance plan, for example, that is not contracted with GRMC, then that's something that I think that they need to consider and also speak directly with their insurance companies, so that doesn't become a barrier in terms of access. So I think that's an important part.
So you are running clinic every day. Is that how that goes? You can make appointments all day long, every day.
Yes.
Monday through Friday. Yeah.
Monday through Friday. Okay. I just got a note from Janella Carrera from the Pacific News Center. She wants to interview you. See how these things go, our television news side. And I think it's because it's extraordinary. I don't know how much of a hero you feel at the moment, but it sounds like you've got a line of people who are listening to this, and this is hopeful, saving information.
Well, I've been overwhelmed by the response. The people who have come up and that I've had the opportunity to speak with, both at the Lupus Awareness Network and it's been really wonderful, the response that people have had to being able to be here.
Somebody asked, does GRMC offer experimental stem cell injections for rebuilding the joints from arthritic damage?
No, we do not.
Okay, and now here goes Julie. Hi, Julie. Good morning.
Hi, good morning. Hi, Doc.
Morning,
Welcome
Julie.
to Guam.
Welcome to Guam. She said, go ahead,
thank
Julie.
you.
Okay, Dr. Pruhs, do you accept all kinds of insurance, medical insurance?
And so Dr. Pruhs is actually subject to the relationships we have with all insurance companies for GRMC. And so as of right now, the ones that are considered out of network are Take Care and also some Stay Well that may be non-participating.
Okay, so at the moment, what's your insurance company, Julie?
Well, I got Stay Well and Take Care.
Okay.
And I've seemed to be having a lot of problems with Take Care being accepted or for them to cover my medication.
Yeah.
I have psoriasis, Patty.
Okay,
And
yes.
several times I've been given a prescription, and what they do is, decline. I don't know what the reason is. We pay for the insurance every 2 weeks. They accept the payments, correct?
Well, yeah, you're getting into an area out of my expertise for sure, Julie. But Dr. Cabrera says, they'll try to work with you. Is there?
Yeah,
what's the best way to do that?
Well, I think just contact our clinic and then we'll try and see what is available available and in what fashion, because
Okay.
in the end I think it's a conversation that you need to have with your insurance company directly, and and tell them this is what your needs are, and that if they're not fulfilling those needs, then I hope that you have the opportunity to to take your business elsewhere.
Yeah. Thanks so much. What's the number for her to call, by the way? Go ahead into the mic. Ace, and do you know how this works?
It's 645-5500, and then ask for specialty clinics.
Okay, 645-5500 to ask for specialty clinics. Okay, Julie?
That's down in Eco Road.
That's up there on Marine Corps Drive.
Route
Route
3. Yeah, Route 3. Right off of Marine Corps Drive. The big
Okay.
hospital.
Okay, thank
Okay,
you.
Julie.
Have a good day.
Good luck to you. Do you take Medicare?
Yes.
Absolutely.
Yes. Okay. I'm talking to somebody who has RA, but she's also got laryngitis. So she's sending me the interview question. So I appreciate that, Mary Lou. Yes, you can use your Medicare. And let's talk to Antonio. Good morning, Antonio.
Buenas.
Buenas.
And good morning to the fine doctors there.
Morning, Antonio.
Morning.
Back in 2003, I was diagnosed locally here in Guam with rheumatoid. Now, I'm looking at the possibility that I am more on the psoriatic arthritis. Is there any recommendation or anything you might want to say about this situation? Can you identify which one after seeing the patient?
Okay.
Sure,
That's a
sure.
good question.
So that can be a tricky diagnosis to make, certainly to differentiate between psoriatic arthritis and rheumatoid arthritis. And there are a couple of things that we can do that can be helpful, which is to say the blood tests that we use for rheumatoid arthritis typically are not abnormal in patients with psoriatic arthritis. So there's some utility there, checking those. And then sometimes the pattern that we see in terms of the involved joints or the way that the joints look on x-ray and that sort of thing can be different between the two. So there's some utility there as well. I would say, I don't know if this is a fortunate thing or if this has been helpful for you at all, but there are quite a few medications that we use for both psoriatic arthritis and rheumatoid arthritis. So there's some overlap there. So even if you were being treated for rheumatoid arthritis, there's a possibility that they were giving you some medications that would have helped with psoriatic arthritis. So there is a little bit of overlap there, so that's important.
I appreciate
No, I started out. Hello?
Yes, go ahead.
I started out with naproxen, and then I was recommended by one of the local doctors to put a stop to it. And currently, I'm taking methotrexate, 2.5 milligram, 10 each, once a week. Is that safe?
Right. So that, so 10 of the, we're getting into pretty specific things here, but 10 of the 2.5 milligram tablets would be 25 milligrams, and that would be the very highest end of what we call low dose methotrexate. So that is actually one of those medications that we use for both psoriatic arthritis and for rheumatoid arthritis. So that's actually, a medication that you could potentially have been treating either of those diseases with that medication. So that's, so that's not uncommon.
Considering now the longevity, I've been diagnosed with this for more than 10 years, 15 years. Is this still a safe after, with the current medication and the quantity? Is that still safe, or is that something that I should be evaluated and recommended to take another?
Antonio, I'm just going to stop you right there because, like the doctor says, it gets a little more personal in your own situation and your treatment log. 645-5500 and ask for the specialty clinics, and you'll be able to make an appointment just to sit down and maybe ask more questions. Than he has the ability to look at your history and discover your history and provide you with a better answer than we might give you on the radio. But would you consider that? Just calling that? Okay. Thank you, Antonio, for the call.
Thank you.
So
Thank you.
Clearly, by the evidence of the phone calls, some people with very personal situations and really reaching out in need of the care. And the best way to do it is to just sit down and talk to you straight, face to face.
Yeah, absolutely. I mean, there's no substitute for that. So, I mean, I can certainly.
And I mean, I think the point is that because there has been many people who have been diagnosed but haven't really had continuing care, they're sort of going, like, sounds like Antonio, going on whatever history was given to him inside of 10 years ago. And all of that could have even changed to the point where he might be able to see some major advances.
Yeah, and the key thing with that is that, you know, our bodies change as well. You know, and then there are other diseases that we may get, other comorbidities that may interfere with or change our plans. So, you know, continuous reevaluation is very, very important. You know, it sounds like being on methotrexate, that dose that sounds very reasonable. We you know, it's not uncommon, but then, you know, if that's been the dose for the past 10 years and it hasn't been really looked at again and seen if there's a monitor for side effects as well, then that can be a problem.
Methotrexate, that is the big deal, is the side effects. There's a lot of people nervous about the side effects of that particular drug.
Well, you know, methotrexate is a very important drug. I mean, we refer to it as a cornerstone drug in the treatment of rheumatoid arthritis. So it has done an awful lot of good. That having been said, yes, it calls for monitoring. So the American College of Rheumatology, typically they say, you know, every 3 months you should be checking really liver function tests and making sure that your blood counts look okay, that sort of thing. Because the problem with a medication like methotrexate, and there are a bunch of them out there that are similar, is that if there is a problem, you know, if there's an irritation of the liver, if your white blood cells start going a little bit lower than we would like, there's a very good chance that you wouldn't feel it early on, okay? It's not until it gets to be, you know, potentially a significant problem where you would start to feel symptoms from it. And if you get those blood tests prior to that, then we can catch it before it becomes a problem and do something about it.
Well, this has really been an eye-opening experience for me. Thank you. What an interesting topic. Clearly, like I said, evidenced by the people who call in. It's nice to meet you. Thank you for coming all this way.
Likewise. Thank you very much.
And so where's your wife from? Where is she? From Wisconsin too?
She is from Wisconsin as well, Oconomowoc, so right up the road.
And so you got a 10-year-old and a 7-year-old?
That's correct.
Are they digging Guam and the beaches and stuff?
Yeah. We're swimming every day. It's great.
Oh, isn't that awesome? How long have you been here now then?
Oh, so this is my 3rd week, so not very long. So.
Okay. Well, clearly we haven't fed you enough. So we'll get right on that one. Yeah. Cindy, thanks for the hookup. That's your healthcare partner. It's brought to you by our friends over at the Guam Regional Medical City. Thanks so much, Dr. Cabrera. It's always great when you're here too.
Oh, I love it.